Hello, my name is Reece Prytle, Rockingham County Commissioner. I was elected Commissioner back in 2016. I'm a lifelong resident of Rockingham County. Grew up, went to school here, graduated high school at Morehead High School, went up to Appalachian State where I graduated in 1989. I moved back to our community because I care about our community. I started my career in law enforcement in 1990 with the Eden Police Department. I worked my way through the ranks with the Eden Police Department, and I retired in 2018 as the police chief. During my time as a detective working on the Drug Task Force, I had the occasion to investigate many crimes, and I've seen the influx of illicit drugs in our community. And during this time, it was crack cocaine. And we dealt with that harshly. We addressed the issues within the community. And as I moved up the chain of command and as my career progressed and I took other positions through the department, I got into an administrative position. But I was always in touch with what was going on in our community with illicit and illegal drugs. And one of the things that became obvious to me in the early 2000s and mid-2000s was the amount of pills that were being used by members of the community. And the stories I was hearing about the cost of buying a pill illegally on the street, a prescription pill, and how it was impacting the youth in our community. And it was very concerning. And then it progressed to, towards the end of my career, where we had heroin made its return. Did not have that much in the beginning of my career, but heroin come back because it became cheaper than the pills, and we progressed to meth. Seeing the impact on my community was very concerning. You know, we have a small community. Rockingham County is made up of about 91,000 people. The city of Eden, about 15,000 people. You know everybody. And one of the things that was very concerning is I was seeing friends and neighbors losing loved ones unnecessarily to opioid overdoses. And it wasn't unique just to Eden or Rockingham County or North Carolina. This was a problem that you could see the wave crossing our nation, a wave of opioid abuse that was impacting everyone. There's children whose parents had addictions, and these children lived and they continue to live in very unstable environments as a result of those addictions. So as a commissioner, when I was elected in 2016, one of the first things I did was I asked our Health and Human Services Director in March of 17 to start an opioid task force. The purpose of this task force was to get all the players in one room to see what we within our community could do without depending on the state of North Carolina or our federal government, what resources we have in Rockingham County. I wanted to make sure that we work together in collaboration to address the quality of life issues in our community. And one of the things that we could do was start communicating. What were we doing? What were we doing right? What were we doing wrong? What could we do better? These were questions that task force tried to address. And in a few minutes, you're going to hear from someone who's going to tell you exactly what that task force has done. But let me just share this with you. I shared with you that I retired from law enforcement in 2018. In my second professional career, I went to work at one of our local funeral homes. And I can share with you that death of a loved one and helping a family through that grieving process is something that you won't forget if you've ever been a part of it. You know, I've had to share many times, I've had to inform someone that their loved one had died, and that's never easy. But now I've seen the back end of that when they're making arrangements and trying to put their loved one to rest. It's still tough. It's tough watching a family, a father and a mother bury their son, or being there when two teenage kids is burying a father. Opioid addiction doesn't discriminate. It don't care how old you are. It doesn't care what sex you are. It doesn't discriminate. It doesn't care your ethnicity. You know, we're losing too many people between the ages of 25 and 44. That's our largest population that gets addicted and dies. You know, we've tried to lower the death rate, and I think we've been successful. We need to continue to work together to address this problem facing our community. 42. The number of people that died last year from an opioid overdose. But together, we can work to reduce that number. We have to reduce that number. The people of Rockingham County deserve to get this poison out of our community and help those that are addicted. Thank you.